Good evening, everyone. Welcome all. So this is one of the important topics. Okay. So let me share my screen. Okay. Can you see my screen?
Yes, sir.
Okay. Fine. Great. So this is very important topic. There's a lot of questions regarding this topic. Not many people have clarity about this. There's a lot of discussion happening, lot of things happening, lot of designs are there. Okay, so to understand this thing, we'll need to understand the philosophy of the cement. Then only it is possible for us to use a cemented uh, stems. Okay, so what is the optimal shape of a stem? How does a femoral stem it should be? Okay, first thing is it should transmit torsional as well as axial load from the cement to the bone, right? That is the main function. Whenever the patient starts bearing weight, it should put the forces should pass from the femur to the stem to the bone. That should be the principal aim. The next aim is without much creating damages, that is peak stress damages, and without causes excessive micromotion. Okay, this is very important to have a long-term results upon repetitive loading. Okay, the optimal shape of the stem, it should be transmit the torsional force, and it should transmit the axial force without producing any debris or without damaging the cement or the bone. Okay, that is the main principal amount of uh, stem or a cemented stem. Okay, let us understand this X-ray. Can anyone of you read this X-ray, please, for me? Anyone? Can anyone read X-ray?
Can you hear me, sir?
Yeah, Dr. Abhinav. Go ahead. Good evening.
Good evening, sir.
Yeah, read this X-ray.
X-ray of left hip showing total hip replacement with
Okay.
uncemented cup and
Okay.
cemented
Cemented?
stem and
Cemented
uncemented.
stem. Okay. This is an total hip replacement hybrid variety where the cement has been cemented, the femur has been cemented, right? Okay. That's great. Okay. Can you read this X-ray? Can you please read this X-ray again?
This is a total hip replacement.
Okay.
Uncemented cup. Cemented.
Okay. Okay. This is again the same thing. This is again the same thing. Sorry. Cemented stem, uncemented cup, again reverse hybrid. Then what is the difference between both of these two? Do you
Regarding
think is there any difference? Do you
quality of
think is there any difference? Quality of cement. Okay. Then what happened to the quality of the bone cement?
the cementing, there is some lucency seen in the first.
Loosening in the
Some lucency is seen in first picture.
this one? You're pointing out this one?
Yes, sir.
Okay. Then
Whereas in the other one there is complete whiteout.
this is completely white out. Completely white out. Okay. Then anything else?
The cup side there is lucency.
No. We'll restrict our discussion only to the femur side. Okay. Okay. Any other difference of opinion do we have in this board? There are only 11 of them.
Collar.
Okay, collar, very good. Next, keep going on. Okay. Any other person wants to differ, or anyone adds to add some more few points for this? Which one do you accept? This one or this one? Which one? Because there is lucency lysis and all, as Dr. Abhinav pointed. There is lot of what to call. So both, but then if there is a lucency, then this, I feel I tell both the things are right. Okay, I tell this both the things are right. So first is this image. This is again hybrid image for a cemented THR. The people who are joined late, for them, I'm repeating again. This is one X-ray where a cemented femur and uncemented cup. This is one type of hybrid THR, and we have other type of hybrid THR again. So we just pointed out few of the mistakes by one of our doctor. There is lucency in the tip, as doctor mentioned. In this stem, he has whiteout cement, and there is a collar. Okay, let's start analyzing the stem. Okay, Dr. Abhinav, I like to tell you that both the stems are perfectly placed. This lucency, what you're talking about, is a deliberate lucency which has been created. Okay, and this collar, what you have pointed out, is deliberately made out. Is deliberately made that to have a collar. Okay, and this whiteout cement you're telling has been deliberately made so much whiteout. Whatever you have seen, that is there. And these things are not done in this, but even then, this is right. This hip is also as good as the hip on the opposite side. Let us start analyzing. That is where your principles of cemented philosophy stems come. Okay, the first module you're seeing is based on loaded taper or forced closed, whereas second one, what you are seeing, okay, is based on composite beam and shaped closed. Okay, let us start seeing the things now. Okay, what is loaded taper and what is composite beam? Let us restrict only our terms to these two, loaded taper. Sorry, something happened. Okay, fine. Let us concentrate only on loaded taper and composite beams. I'll be speaking only in terms of loaded taper and composite beam. Okay, fine. First, start analyzing loaded taper. This is how a loaded taper stem looks. Okay, the lucency what you are seeing is because of this part. What is this part, Dr. Abhinav?
It's centralizer.
Yeah, it's a centralizer. This is where you are seeing the lucency. Is there any collar here?
No,
No. How the stem is appearing? Can you describe the stem?
stem is smooth.
Smooth. Okay.
There is singularly tapered.
No. See what happens is this is a loader taper stem. Okay. As we have pointed out, this is the centralizer. Okay, that is what the lucency you've seen. It is smooth. Okay. Then Dr. Abhinav was telling me there was no collar for this stem. Okay. Then any other thing? It's taper, right? Okay, it's a taper. So what happened? What is the type of this stem is? How this stem works? Why did they make this centralizer? Why did they make polish? Why didn't they didn't make any collar? Okay, this is where the loader taper stem. So the stem usually has. Yeah, sorry. Yes, please.
Sir, your sound is echoing, sir.
Is it now also?
No, sir. It's fine now. Thank you, sir.
Okay, fine. Okay. So what happens is the loader taper stem, the characteristics are, most important thing is it's a wedge. Okay, wedge where, consider this is as the bone cement. Okay, this is the bone cement. The femur stem is wedged into the cement. Okay, that is the reason it will always have a taper. Okay, in two planes, either one or two planes. Okay, it gets lodged as a wedge in the cement mantle. Okay, and the stem is allowed to subside initially. Once there is subsidence of the stem, okay, there are forces which develops radially, okay, all across, that is transmitted via cement, and that is where it gets transmitted from to the bone. Okay, and the distal tip, what Dr. Abhinav was pointing, okay, this tip is the distal centralizer where the stem is allowed to subside within that air pocket. Understood? Okay, this is very important characteristic of a cemented stem. Okay, for a loader tip. Okay, it is tapered. It acts as a wedge in the cement mantle. Okay, it is allowed to subside initially. Okay, and how does it act? Upon loading, the radial compressive forces, whichever it generates, it is transmitted onto the cement. Then via cement, it is gone onto the bone. And the distal tip, what it was radiolysis, what it was mentioned, it is the centralizer where the stem is allowed to subside. Okay, this is a characteristic of a loader taper. This is very important. Okay, understand this concept.